As Republicans grapple with their messaging on reproductive issues, former President Donald Trump has dubbed himself the leader of IVF. Here he is during Tuesday night's debate.
President Harris,
excuse me, I have to respond. Another lie. It's another lie. I have been a leader on IVF, which is fertilization.
A few weeks before that, not only did he declare support for in vitro fertility treatment, IVF, he also took it a step further, saying that if reelected, insurance companies would actually have to pay for this procedure. Let's listen.
But for the first time ever, your government will pay for or require insurance companies to pay for all costs associated with IVF fertility treatment.
Surely the reason behind Trump's embrace for IVF for all is Harris has been leading with women voters. According to a recent ABC News Ipsos poll, she's leading Trump 54% to 41%. Senate Majority Leader Chuck Schumer heard Trump loud and clear. Per Axios, the top Democrat in the Senate is planning to unveil a bill within the next 2 weeks that mirrors Trump's proposal to mandate insurance coverage of IVF treatments. The power move will likely force a bigger wedge between Republicans who voted down a measure that Democratic Senator Tammy Duckworth introduced in June, which would establish a right to access IVF treatments and mandate that public and private insurance plans cover such treatments. So we've heard the allegations from J.D. Vance that the Democrats are just copying whatever Trump says. I said on a Friday Rising episode with Amber, isn't this good that if a policy is popular that both parties choose to adopt it? It seems common sense to me, Robbie.
Yes, and I think being in favor of making IVF available is a very good thing. I'm having trouble understanding. I don't think so. I'm in full support of IVF. I think people should use IVF. I don't know that I don't think the federal government should require insurance plans to cover it. I think if you want an insurance plan that covers it, you should be able to get that one if there is. I think I want more choice and control over people in terms of what kind of insurance coverage they need, what works for them. I don't know that I would blanket say at the federal level this needs to be covered is, I guess, what I would. Again, we're not talking about banning it or getting rid. Like, it should be available to people who want it, but should it be subsidized or through the insurance system? It can be, and if insurance plans want to offer that kind of coverage, and maybe you pay a higher premium or to be on that kind of insurance plan, that's all okay. But just kind of saying that mandating that they have to do it or the government has to do it is probably not a good idea in my view.
I don't know. I think paying out of pocket for fertility treatments is extremely expensive. And I'm sure there's a lot of folks that have had to work until they could afford a home and afford to have a child. That means that maybe they're a little bit older. Maybe it's a little bit harder to conceive. So they require IVF in order to conceive a baby successfully. I think it's a smart move for Republicans to be on board with this and for Trump to be talking about it so much. Because I think there's a lot of people that, see the healthcare industry as one that unnecessarily denies treatment. Of course, if it's required for insurance to cover it, there's still going to be the usual process of questioning whether or not it's necessary, denials. They're going to have to likely prove that this woman is someone who cannot conceive a baby naturally, that it's been difficult, that she's been trying. I can imagine, even though it's covered by insurance, this still being an insanely arduous process to get that coverage. I had a necessary scan yesterday that if I were to apply my insurance, it would cost $1,600. But if I were to opt for self-pay, the same exact care costs $860. That doesn't make any sense. The American healthcare system is an absolute disaster. And I think requiring that insurance covers, what was that?
We agree on that. That's because of the insurance system, is because prices are disguised because you're not actually paying the price, so they don't the people charging the price. I mean, the doctors, the medical system it's a little bit like tuition, where it's because you're not, for people, you're going to take out, you're paying it through some indirect mechanism. You still pay for it ultimately, or you pay a portion of it, or you pay it later. But because it's not the same as like, going to the grocery store where I, hand over $100 for groceries or something. These days, a lot more than that. But you know what you're buying, you know exactly what it costs, and you pay for it. In the medical healthcare system, it's the price is disguised through all these mechanisms, so the people actually providing the service can upcharge you because they're not necessarily charging you. That's the whole problem with the system. In terms of the difficulty of the hoops you have to jump through to get IVF, I agree with you. I bet it's very, very arduous. And I don't really want it to be more arduous, but that's the problem with having a subsidized system, because if it's required that they pay for it, if we're all paying for it, then vis-a-vis the insurance system where the cost is distributed amongst the people who pay into the insurance plan, well, then we do want to make sure it's necessary, et cetera, because it's our money ultimately being used for it. You want some kind of, if people are just paying it for it on their own, then I don't want it to be arduous for them. They should get what they're paying for. But if the cost is then broken up and paid for by everyone, all the taxpayers or everyone on the insurance plan, then you do want it to be thorough to make sure it's being done with all necessity, so that people aren't getting medical services that cost tons of money when they don't need them, because that cost is being passed on to other people.
Well, that's how all insurance companies work.
Well, I know.
I think that's why. Yeah, it's.
Well, that's
why
I want it to be a voluntary thing where you pay into it, and that's how it works, because you're a participant in it, rather than having it be required.
What's interesting, though, is with a public option, or with rather Medicare for all, let's look at that, we would save trillions of dollars. We're spending so much more because of these insurance companies actually being separate. We lack a negotiating power as consumers. And so insurance companies are keeping prices pretty high. Working with a lot of our hospitals, we're paying more for the same exact treatment, sometimes worse treatment, than other modern Western countries. We would save nearly $20 trillion by switching to a system that is a single payer healthcare system, because we would be able to negotiate those costs down. So yes, it is the kind of thing where insurance companies make their money and are able to exist because they pool in steady money from all of their members. And then when someone has an emergency, the money is there to pay for it. And that's just how insurance works. So if everyone's sort of on the same plan in a way, we can negotiate prices down. We can free up a lot of our productive capacity by having those insurance workers work in other industries. So I think let's keep at this. Let's tell Trump everybody really wants dental care to be included in their health care, because let's face it, dental care is a healthcare issue. If someone has an infection in their mouth, that can spread to their brain and blood very quickly. And so this idea that it's separate is ridiculous. I think let's keep bullying the politicians into competing for who has the most popular policies. Let's tell Donald Trump Kamala Harris is covering dental care and see what happens next.
We'll have more Rising right after this.